Well, before we jump into how do I do the role, it's important to understand Providence a little bit. So we are in 5 states. We operate everything from 4-bed hospitals in the most remote part of Alaska to the very large Sacred Heart in your neighborhood. We are in 5 states. Taken together, there are about 50,000 of us. 17,000 or so are registered nurses. So communication in our organization is a challenge no matter what. But if you think about the history, in the mid-1800s, the Sisters of Providence showed up in the state of Washington with almost nothing and really created this system one step at a time with unbelievable courage and vision. And so in my role, there was no nurse anything leader in the system until this past fall. So I'm stepping into a role that never existed before, trying to bring together all of nursing. And doing it fast, actually. We have a lot of work to do, and we need to sort of align ourselves together. So my job, in my view at least, is to really build on the history of some unbelievably visionary, courageous, and strong women who had a vision in the 1800s, and it has never wavered. So I am very fortunate to understand my role pretty well as a visionary leader in Providence, because the truth is, all of the nursing care that was provided from the time the system started in about 1860 was provided by Sisters of Providence who were also nurses. So they were practicing nursing before we even licensed the profession, and really sort of set the standards very high for nursing practice. So it's not been very difficult for me to understand. My job is simply to take that vision a little bit harder and faster and uphold the very high standards, uphold the very sacred relationship between the nurse and the patient, and to keep understanding that our job is to serve those in need, whomever or wherever they are.